Have you ever taken the marshmallow test? Are you an impulsive person? Do you have to have the newest stuff right now, or the answers right now, or the results right now? If so, this matters in your healthcare and makes a difference in terms of your ability to improve, get better, and stay better. Socrates said, "Know thyself." And for you to get the best results from your healthcare, you need to know thyself. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. So knowing thyself starts with knowing your result for the marshmallow test. If you're not familiar with the marshmallow test, you could Google it, or you could search marshmallow test on my YouTube channel and watch my kids doing it. If you're an adult watching this, then you've aged out of the marshmallow test because you could will yourself to the right response in that test. So to know how you would have probably done on the test when you were a child, you could observe how you act now. If you are impulsive, if you are someone that has to have the newest thing or has to have the answers now or has to have the results right now, then you probably would have failed the marshmallow test as a child. And why is that important? Because the marshmallow test is a predictor of how successful you will be later in life based on your ability to delay instant gratification. So how is this important in your healthcare? Well, when you commit to a treatment plan in healthcare, whether it's with a medical doctor or a chiropractor or a functional medicine practitioner or a physical therapist or a surgeon, anyone you're committing to a care plan with requires that you commit and follow through with that care plan. A care plan is created with the assumption or the intention that the person following it, the patient, so to speak, is going to complete it fully. If you don't complete it fully, the results that you gain may not be sustainable. What am I saying? Well, say you were someone that partnered with me in my practice. If we set a goal, say, hey, let's work for 3 months to achieve these goals. If we set that goal and I create an action plan for you and you begin implementing it as I recommend, and you feel better at 6 weeks, that's amazing, and that wouldn't be uncommon. It's very common in the practice. The problem is if you are the impulsive person or who loves the instant gratification, you're happy, you achieved your goal, forget the next 6 weeks, I'm feeling good, I'm going to do what I want. Well, the risk there is that you haven't completed the treatment plan. And remember, that treatment plan was designed with the intention that you were going to complete it. And behind that intention was the second 6 weeks is to continue working through the layers of your onion, or the layers of the onion in your case, and to continue to accumulate momentum towards healing and cement in the positive benefits you've realized at 6 weeks. If you say, I'm impulsive, I'm happy, I'm going to go back to doing what I want to do, the probability is that you're going to lose those positive changes and lose the momentum you've built. So you may not get back to those positive changes as quickly as you did the first time. So I would recommend that if you know thyself and you know that you're an impulsive person and you don't delay instant gratification well, that you need to keep yourself in check and have some sort of accountability to yourself to say, no, I committed to this action plan or this treatment plan for 3 months or X months, whatever it ends up being with whatever practitioner, and I'm going to see it through because I know that it was made to be seen through, and that whatever positive benefits I'm realizing early or at the halfway point or before this plan is over need to be cemented in through building momentum and changing my lifestyle and incorporating whatever it is that the treatment plan is incorporating, so that when you get to the end, you don't mess up or make one false move and lose everything you've created. The point here is to create momentum, create habits, create change that is sustainable and going to carry on long after you and I are working together, or long after you and whatever practitioner are working together. So know thyself, so that you can set checks and balances to keep you from being you and keep you on the path towards achieving the goals you and your practitioner set out in the first place, so that you can achieve that life at optimal.